Thank you for inviting me, and thank you for watching and coming here to learn more about NF2. As Claes said, it's very important for us, patients and parents, to understand what is this disorder about. It is a very complex disorder, so anything that we can learn is crucial, very crucial for later on taking the right decisions, for understanding, for not panicking, for understanding better the disease, and then often you panic less stress by knowing more. So I hope that during this very short session, I'm going to be able to explain or teach you a few things and give you some materials later that you can review and use. So I'm a dad of Karen. Karen was diagnosed when she was 6 years old. She's today 15 years old. She was diagnosed with NF2. She had several surgeries already, but she's still fighting and she's still very fine and performing. But as you know, NF2 is a complex disease attacking many different parts of the body. So the fight is never ending. Because it is a very complex disorder, there is really a need to have the right team of doctors around us, because this disease attacks the head, the brain, the spine, the eyes, the hearing, and basically any peripheral nerve. And that's have many different kind of symptoms on the body. So that's why we need to learn as much as possible. And it's complex because there is not only one doctor that can tell you everything you need to know. As I'm sure you met geneticists, neuro-oncologists, maybe neurosurgeons, ENT specialists. Each one knows their silos, but you are the one that needs to connect the dot. If you don't have access to very clinician expert in NF2 that also can connect all the dots, you need to be that person. That's why you need to learn as much as possible about this disease. For example, Jessica, she's in Canada and she was diagnosed when she was 8 years old. So as you can see, she has many problems that develop in her body because of NF2, and it attacks many different things. So you can see all these different words on the screen. And if you are new in NF2, it doesn't mean anything. It's very complicated, complicated to write these words or to pronounce them. And that's why each of these words, symptoms, type of tumors, you will need to read about it and try to understand. I know it's hard to be on top of it all the time, but you should find what's best for you, maybe a few hours per week to focus on it and read a little bit more about all these different things. So for example, you can have a problem with the sixth cranial nerve that deal with the movement of the eye, different type of eye condition, different type of tumor like ependymoma tumor or meningioma tumor or vestibular schwannoma tumor, cutaneous skin tumor as well, multiple things. And that's why it's crucial to slowly to learn about it. When my daughter was diagnosed, when she was 6 years old, it took me a long time to understand these things. I was reading research paper, reading things on the internet, talking to a lot of doctors, and slowly you are going to be the one knowing more than the doctor that you are seeing. So I would like to talk more specifically about a few tests that any NF2 patients are going through, almost everyone. The first one is the MRI. So MRI is a scan where they scan your body, they scan your brain or your spine. It is very long. It takes, for the brain, it takes between half an hour to 1 hour, depending on the resolution, on how precise it is. The spine is even longer because the spine is longer. If you do the full body, and very few people are doing the full body, then that's way longer as well. Usually, this has to be done every 6 months or 12 months. If it is really stable, you don't see any growth of the tumor, then you could maybe switch to once a year. Then many patients are afraid sometimes about doing often MRI, like every 6 months or every year, because of gadolinium contrast that they inject in the body, so you can flare up the tumor and see the tumor looking very white. Like on the bottom right, you can see this tumor. It's white. It's white because of the gadolinium liquid that they inject in the body. And so some people are afraid of this liquid, but the risk of this liquid is very, very minor compared to the risk of not doing the imaging, of not following up the growth of your tumor. Because if you follow up the growth of your tumor, you can decide what to do, and sometimes it's not too late to do something. So one thing to know about MRI is not 100% accurate and clear. So the size of the tumors that is described in your MRI report is never very accurate, because they do slice of images. And so it all depends on where your slice cut the tumor. And your tumor is not a round ball. It has a very weird shape. So that's one thing to know. The size that they describe in your MRI report is not accurate. And when they say it's stable, it might not be stable. When they say it grew, when it says it grew a little bit, it might have grown more. So that's why it's important to do it in a place that they are first doing very well the MRI, but doing it also very precisely, and also to do it often. So if one time the accuracy was not very good because the slice was not at the right place, then 6 months later you might have a better image of it. So that's why it's important to do it often. Sometimes in some places they do volumetric measurements, so it's very manual, very technical. Someone spend a lot of time on your MRI, and then they try to measure every slice. But this is done in very, very little places. Sometimes you have to pay for it privately. Sometimes if you are in a trial, they do it for you. Unfortunately, most of the patients don't have access to it. So we have to follow this 2x dimension measurement and do it as often as we can. So why it is important, again, to do MRI? Because you would like to know the tumor growth, how fast your tumor is growing. Maybe it's flat, maybe it's stable. For example, on the right side, you can see this graph. These are the tumors of my daughter. So each color is a different tumor. So you see some are flat. The green one is very flat. So I know that this one, is maybe growing, but very, 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 very slowly. But others are growing very fast. Here it went down because we did a surgery. So the red one, we did a surgery. That's why the volume fall drastically. So if you don't have this 1 year, 2 years of follow-up, and if you don't understand the growth rate, then it's hard to take a decision to take a medicine, a Avastin drug, for example, or to do a surgery or radiosurgery. It's hard to take that decision if you don't have the information about the growth of your tumor. Once you do the MRI, you are receiving a DVD, a disc. It's very important for you to keep it and to save it on the cloud, maybe on Google Drive, because often you might have to look back, the doctors might have to look back to it, because suddenly we discover a new tumor and then we wonder, was that present before? And then when we look back in the other MRIs that were done before in the past, then we see it, because the radiologists are missing often. It's very common to miss something, to not seeing a tumor, sometimes because it's too small or because they have way more too many MRI to review, and they do mistakes. The mistakes are very common. So always keep your old DVDs. And also, it's very important, if you want also to get a second opinion from an expert, you can always send this DVD or the copy of the DVD. You put it on a Google Drive and you share your Google folder, for example, to a doctor that is in another city or in another country. You can also look by yourself at the images. Usually in the DVD, you have an executable file that you can click, and then you can start to look at it. I recommend you, I'm not a doctor, so I don't want to teach you these things, but you can ask your doctor when you are at their place, when they are looking at your MRI, you can ask them, how do I look at my MRI? Can you show me? You can tell them to do a screenshot. When you are with them, they do a screenshot, they send it to you by email. So you have images as well that you can show to other doctors. And that's important to do. And then there is an MRI written report that you are receiving after a few days or few weeks. That's very complicated. It's very complicated to understand this report. So one thing I was testing a ChatGPT, how ChatGPT could help me to understand the MRI report. But one thing also, to understand the MRI report, you need a doctor to explain to you, but you don't know which questions you can ask. So if you use ChatGPT to generate questions that you can ask to the doctor, it helps a lot. So there is no bad questions. You don't care if ChatGPT is writing something bad, because it's just a question at the end. It's a question that ChatGPT is generating. So, but you come with the questions to your doctor, and then you utilize this short time that you have with your doctor in the best way. So, for example, you can ask and if you don't know ChatGPT, please ask a younger person in your family. I'm sure they are using it already at school or at university. So ask any young person and they will tell you how to use ChatGPT. It's very easy. It is online. It is on internet. So you can ask to ChatGPT this simple sentence. You can write, below is my MRI report. I am an NF2 disorder patient. Which questions could I ask to my daughter regarding this MRI report? And then you copy paste the MRI report. I will show you an example. So, for example, this is the questions I asked to ChatGPT. Below is my MRI report. I am an NF2 patient. Which questions could I ask to my daughter regarding this MRI report? And this is my MRI report that I copy paste. And then ChatGPT is replying to you. Okay, for example, he detects that there is an optical nerve thickening, and then he writes you the questions that you can ask your doctor about that. For example, how might this affect my vision? And would any intervention or further monitoring be necessary? So that's something you can ask your doctor. For example, there is a meningiomas in your report. You can ask the question, are the meningiomas likely to grow and change further? And what symptoms should I watch for? So there is a lot of examples of questions. So you can come ready to your doctor and ask the right questions. Then another type of test that you have to perform when you have NF2 is hearing test. And that's also very important to do it every 6 months, and do it also at the same location. So that you use the same machine, the same technology. And so the results will be similar. Very important to know, because in order to detect if there is something impacting your hearing, because sometimes the tumor doesn't grow, but the tumor impacts your hearing. Why? Because the tumor is secreting can secrete a toxic protein that gets stuck in the cochlea. And that's why some people that have very small tumor that doesn't grow can lose hearing. Some no, some don't, but some can. And that's why it's important to do the audio test as well often. So do it at the same location, because if you do it in different clinic, sometimes they don't use the same technique, and then you might have different results in your hearing test. Another test that is being done sometimes, not often, it's very simple test. They put some electrodes on your head. You have to stay very calm, almost like you are sleeping. And then they do clicking, and they measure the cochlear nerve, how the cochlear nerve is functioning. And sometimes also when you have a perfect hearing, you can already see some things going on in that cochlear nerve. The speed of the waves that go through the cochlear nerve might be slower than the normal. So it means there is maybe some pressure. The tumor is pressuring on the nerve. The hearing is still perfect when you do the hearing test, but you can see some symptoms already in the cochlear nerve auditory brain response. And that could motivate you maybe to take some action. And also, if you do a surgery, that's what they do during the surgery. They use this ABR to monitor your nerve to make sure that they don't touch it during the surgery. So if your nerve is really damaged, it makes the surgery. If the auditory brain response is the cochlear nerve is very damaged, it makes the surgery a bit harder to perform as well. So that's why it's important to know the health of your cochlear nerve. But I know that in USA, for example, not many people have access to it. They do it in France, for example, in Israel very often. That depend on the countries. Another thing is that I cannot talk about all the ongoing tests that you perform when you have NF2, but I selected the most important one, the MRI, the hearing test. And I think the third most important one is ophthalmology, the eyes. And often we forget about it. We are focused on the hearing. We are focused on the tumors in the head or in the spine. We forget about the eyes, but the eyes are so important. First, because you have a risk to lose your hearing. So if you don't have hearing, you need your eyes to communicate, to do sign language. But also the vision is very important for your balance. If you don't have vestibular nerve, because the tumor is destroying the vestibular nerve, or because you did a surgery and you have no more vestibular nerve, then you compensate your balance with your eyes. And if you don't see very well, then your balance is very bad. My daughter had being removed her both vestibular schwannoma on both sides. It means she doesn't have any more vestibular nerve, but she's using her vision for the balance, and she's totally fine. Maybe because she's young, so the brain adapted better. But she ride horses, and she even jump on horses, even that she doesn't have vestibular nerve. So that's very important, the vision, and that's why with my daughter we go 2-3 times a year to the ophthalmology and different type of doctor as well, because there is a long list of problems that could emerge in NF2 patients. These are the lists below. Like one of the most common is cataract, but also epiretinal membrane. And some are things that you can, if you detect them early on, you have preemptive solution for it. For example, if you have a detachment of the membrane, if it starts to have some kind of pressure detachment, then you can do a laser around it so it doesn't detach more than that. So there is in some cases things to do about it. And also avoiding, if you have a cataract, if you take care of the cataract, then you might avoid a lazy eye later on as well. How we do with the time? I think I have still a few minutes more. So in NF2 Biosolution, I'm vice president of NF2 Biosolution. We are a non-profit made of parents and patients, and the goal is mainly to fund and push novel therapy research for NF2. So really, we raised funds and money to pay for projects in the labs and developed novel therapies like in gene therapy, immunotherapy for NF2. But also we want to teach our community, our NF2 patients about NF2. And we made a few webinars already. You can see the link here on the screen. https:/nf2biosolutions.org/nf2biosolutions_webinars. In there, you have a list of webinars, but here, these are the 4 main webinars that you might be interested in. On the bottom left, you have one about the basics about NF2 to understand NF2 from expert of NF2, and again about expert. What is an NF2 expert in NF2? It is, for me, it is someone that knows the natural history of NF2. He knows how NF2 developed over 20 years, 30 years. Because if the doctor doesn't have this knowledge, if he didn't have a patient for 20 years, many patients for 20 years, he doesn't know what's the impact of wait and see. He doesn't know what's the impact of doing that kind of surgery. He doesn't know, he had not seen real cases. So it's very important to have a doctor that really have followed NF2 patients for a long time. And of course, because it's rare, there is not so many doctors, but in each country, often there is a few doctors that really have most of the knowledge, are seeing most of the NF2 patients. So during these webinars, we are inviting these people that have seen a lot of NF2 patients. The second webinar, the surgical management, we talk about surgery in NF2. Then the third one, we talked about radiotherapy in NF2. Then the fourth one on the right is about the vision manifestation, the eyes. And we are planning to do more of these webinars. Thank you, and we'll be happy to answer to some questions if I can.
Thank you very much, Charles, for this comprehensive overview that really shows how, how much there is to know for parents, for patients, and how they need to be advocates for their own health. I also believe that the webinars are also available in some different languages and subtitles that can be offered. So please really highly recommend to go to the YouTube channel of NF2 Biosolutions and check out the webinars, which are really fantastic. And are there questions in the audience?
Thank you so much for sharing your insights into NF2 situation. I have a comment regarding your proposal to ask ChatGPT to help with developing questions for an MRI report. I think it's really brilliant, but if I may, I just have one small suggestion here, because we know that ChatGPT is an AI solution which openly collects data that we're downloading. So while uploading your questions, I think it should be really necessary not to download your personal data, such as your name, your age, because otherwise all this information will be collected and it might be used. So maybe just to be on the safe side, it's better to take this into account while uploading your information for generating questions. Thank you.
Yes, you can copy only your report without your name, without your IDs. That's understandable, yes.
Other questions, maybe in the chat, Virgil, asking you?
Thank you for your explanation. I learned a lot about it. How is it about a discussion, surgery or not? Is that a topic at your or other treatments? Are you discussing that?
So could you ask again? Are you asking, what are you asking about the surgery?
Surgery is one option for taking away the tumor, but there are also gamma knife or medical treatment.
Yes.
Is there a discussion about it?
So yes, so in these webinars, especially the surgical management of NF2, there is discussions there. There is some neurosurgeons that are really proactive and they really want to remove them as soon as possible. There is some other doctors that are more conservative and really wants to wait for the option, to do some other option first. Same for radiotherapy. When to do it, at which age, at which moment. So during this webinar, there is a lot of discussion. But the most important things, in order to be able to decide, because at the end, we have to decide, the patients. The doctor, from our own experience and from all the patients I know, very often the doctor is not telling the patients to do it. Only if there is really a risk of dying because of the tumor, then they tell you. But since it is risky to do this surgery or to do radiosurgery for different reasons, they are afraid to tell you what to do. They can suggest very lightly, but for you to take the decisions, you need to know the information. You need to understand the results from the MRI report. You need to have done all the tests, the hearing test, to understand that, okay, something is happening. It's not that stable. If it is stable, then you won't want to risk. If you see that everything is stable, the hearing nerve, cochlear nerve is okay, there is no growth or very slow growth, then you won't risk. But if you have the understanding and the information, if you follow up all your MRI, you yourself, you wrote into a document the size of the tumor, because the doctor, he doesn't look at the last 5 years of your results. with the size. You have to do it. You have to write the size in the table somewhere, the size of the tumor, and make a graph and see, okay, that's there is a growth. Now the growth is stronger, and that will motivate you maybe to take a decision or not. So yes, there is discussion. The specialists are discussing about it, but the patient is totally part of the discussion. And only if you have the knowledge, you can decide what to do.
Thank you so much, Charles. We need to switch to the next talk. Unfortunately, time is running out. Just want to really congratulate you and NF2 Biosolutions for the exceptional work that you're doing, and also knowing that you are from Israel and living in Israel. I want to say that our thoughts and our best wishes go out to you, and we hope that you are staying safe, you and your family and your fellow people in Israel.
Thank you. Thank you
so
very much.
For
yeah,
being with us.
They are very hard. Thank you.